So hello friends, this is our video on morphine. In previous video we have discussed about the classification of opioids, its receptors, its action, and now in this video we are starting with the first, and it is the most important, morphine. Okay, and mechanism of action of morphine, you are knowing it can stimulate your mu and kappa receptor both. Now the actions. So actions will be same as you have studied in our previous video. It is what are the actions performed on the mu stimulation or kappa stimulation. Same we are going to discuss here. So first we will look for the action on the CNS. Okay, so some center will be stimulated and some center will be inhibited, okay, by the morphine. So what are the inhibitory action, inhibitory effect? So the first is analgesia. Due to inhibitory effect there will be analgesia. Okay, so by the stimulation of these two receptor there will be suppression of brain center in brain, okay, and periaqueductal gray matter you are knowing from the physiology classes. Then it can also suppress your substantia gelatinosa area present in the spinal cord, and suppress your pain. And in periphery it will suppress the sensory nerve depolarization, and that will decrease the pain. So acting at the CNS level, at the spinal cord level, at the periphery level. Okay, now this type of receptor also present on these receptors present on presynaptic, so they are also known as presynaptic receptors. Okay, and they will generate inhibitory potential there, and that will also cause decrease in pain. Okay, now maximum effect on the pain of visceral pain. Okay, so in the cases of visceral pain, morphine is the drug of choice. Okay, drug of choice, opioids. So in the cases of visceral pain, drug of choice is your opioids because maximum effect on pain of visceral pain. Okay, the second is your somatic pain, that is the pain due to inflammation, and for this NSAID we use, and for the neuropathic pain, okay, we use pregabalin. Clear? So these are the three types of pain, and in cases of visceral pain, the drug of choice is opioids. So what are the visceral pains? Basically colicky pain or cancer pain or post-operative pain, crush injury pain, deep-seated pain. These are the examples of visceral pain. Now in the stimulation of mu receptor there will be stimulation of ventrotegmental area, increase dopamine, that will cause euphoria, okay, and apprehension and dysphoria associated with pain is relieved. Now it has more efficiency, so it is given for treatment of severe pain also. Now the second is your sedation and drowsiness. By the suppression of RAS, that will cause increased sedation. By suppression of locus radius, that will cause decreased noradrenaline discharge, and that will suppress your anxiety. And if given to normal human, then it will cause lethargy, lack of initiatives, increased sleepiness, decreased attention span. Okay, now decreased judgment is also there. Now in the third, mood changes. So mu receptor stimulated, ventrotegmental area stimulated, dopamine increases, causes euphoria, so it will lead to addiction like problems. Now in high doses it also stimulates kappa receptor, so there will be dysphoria. The fourth, that it suppresses your neuroendocrine secretions, LH, FSH, ACTH, TSH, all will be suppressed. Clear? And can lead to infertility, libido, menstrual irregularities like this. But it will increase prolactin and growth hormone. Suppression of this four, but can increase your prolactin and growth hormone. The fifth is your suppression of the vasomotor center, and that will cause low BP and low heart rate. The next is your suppression of the respiratory center, that will cause decreased respiratory rate. The next is your suppression of hypothalamus, so body temperature will be decreased, and that will lead to hypothermia. So these are the inhibitory effects. Till now we have discussed about the inhibitory effects of the morphine. Now we are moving for the stimulatory effects. So first is your CTG area, chemoreceptor trigger zone. On the stimulation of chemoreceptor trigger zone, there will be vomiting and nausea. Clear? Now the next is adrenal vespal nucleus. So GABA is inhibited there, so there will be stimulation of adrenal vespal nucleus. So third canal number will be stimulated, and there will be increased circular muscle activity of iris. So there will be contraction, and that will lead to meiosis. Vagal center is also stimulated, so vagal discharge will increase, that will lead to acetylcholine increase, that will cause bradycardia. Cortical centers are stimulated. Okay, non-specific stimulation of cortical centers will lead to seizures, muscle rigidity like this. Okay, so these are the actions on the CNS. Now moving to the action on CVS. So as we have discussed many actions earlier, suppression of vasomotor center, vagal effect is more as it is alkaloid, so it can lead to increased histamine, and there will be vasodilation. Clear? Now on GIT, mu is stimulated, so there will be decreased peristalsis, increased tone and segmentation of small intestine wall, so and also increases tone of sphincter. Okay, and that will cause constipation, and the second effect is decreased GIT secretions. The next endocrine effect, so it decreases pituitary hormone secretions. Okay, all these hormones will be secretion will be decreased, that will lead to hormonal disturbances, sexuality decrease, menstrual irregularities, and diuresis. The next system is your respiratory system. and respiratory center if get depressed, then it will cause your respiratory rate suppression, then it will cause decreased tidal volume. Okay, the next is your genitourinary system, so it relaxes uterus and bladder, so delay labor and causes retention of the urine. Okay, now what are the pharmacokinetics of morphine? So it can be given orally or IV route. Oral route has high first pass metabolism, so decrease in viability is very less. Oral is to parental ratio is 1/4 or 1/6, like this. Increased lipid solubility, so tissue entry will be fast. So hemodialysis is not successful in morphine poisoning because of the high lipid solubility and high tissue entry. Basic in pH, liver metabolism is involved through glucuronide conjugation. So morphine in liver undergo glucuronide conjugation and converted to morphine 6 glucuronide. This is the active form, and morphine 3 glucuronide, this is the inactive form. Okay, and this inactive form is eliminated by kidney. So in CRF patient, morphine 3 glucuronide will increase, and that will cause increased cortical center stimulation, and that can cause seizures. So morphine is your contraindicated in CRF. Mind it, morphine is contraindicated in CRF due to this reason. T half is 2 to 3 hours. Okay, so short acting. Okay, but its analgesic effect is up to 24 hours due to its active metabolites. Clear? Now coming to the most important part, that is what are the indication of this morphine. So first is analgesic. So they are the drug of choice for the visceral pain, post-operative pain, cancer pain, cross injury, or road traffic accident. We have discussed. Okay, these are the drug of choice for this. Pre-anesthetic drug. Okay, because it suppresses your anxiety and increases sedation. This can also be used for non-infective diarrhea. Okay, diarrhea which is due to diabetes mellitus or chemotherapy induced or stress induced. It also suppresses cough. So they are drug of choice for the dry cough. Okay, it is used as antitussives for the dry cough. Now the next is your acute CHF with pulmonary edema. In this you can use morphine, because morphine has similarity with your furosemide, about same action. Okay, it will cause venodilation, so it will increase peripheral pooling, so decreases venous return, so decreases congestion, so decreases pulmonary blood flow. Okay, second drug of choice for the pulmonary edema associated with CHF after furosemide. This is the second drug of choice. In cases of MI, you can give for the decrease in pain and decreasing anxiety. What are the side effects? So non-specific side effects are constipation, decreased heart rate, decreased blood pressure, meiosis, muscle rigidity, decrease in respiratory rate, and increased sedation. Hypersensitivity reaction, because it causes increased histamine formation. Okay, so there will be rashes, bronchoconstriction, and precipitation of colicky pain also. Increased chemo trigger zone, then it can cause nausea and vomiting. Physical dependence is there, so chances of addiction is there. Okay, and then okay, and then your tolerance. Okay, receptor down regulation will be there. Maximum tolerance seen in euphoria effect, and no tolerance is seen in your meiosis and constipation. This question is asked. No tolerance is seen in which effect? So meiosis and constipation. These are the side effects which we are discussing here. Okay, rarely hyperalgesia, known as opioid induced hyperalgesia, can also occur. Decreased pain center pathway can cause supersensitive, and that can increase your pain. Non-painful stimulus can cause pain. Okay, so this can be the side effect. What are the contraindications of pregnant, neonates, and old patients? Acute bronchial asthma, biliary and renal colic, because of the increased chances of precipitation of these conditions. Then head injury. Okay, because it can suppress respiratory center. Then respiratory rate will decrease, increase CO2, so that will lead to vasodilation, increase cellular blood flow, and that can increase the risk of hematoma. And also it stimulates CTJ, so vomiting and nausea will be there, meiosis will be there. So in that conditions, they are contraindicated. Morphine is your contraindicated. Okay, so and the last is your emotional instability. Okay, in this case also this is contraindicated. Okay, so thank you for watching.